Okay, we are back again with another clinical conversation. We have Alyssa Hurless here again, and we have Ashley Langford here again, both physical therapists at CORA Physical Therapy, both very smart people. And we are again talking about storms and how weather impacts just physical therapy. But this time we're going to take it from the clinical approach. So, for example, if you are a new therapist, even a seasoned therapist, we're going to talk about some of the things that are involved with patient care when there's a major weather event occurring, coming into your area, how to kind of wrap your head around some of the things that might happen. So I guess what I'm going to ask first is, how does weather impact patient care? But what I mean by that is, first, can weather changes impact a patient who's been coming in for treatment? For example, we were talking recently about inflammation and how joints can hurt during temperature changes, humidity, rain, something like that. And so how can you deal with that, be present if you're a new therapist, all of a sudden your patient comes in and they start complaining about the weather changing the way their joints feel? How do you approach it?
I think it's a reference to how we need to assess our patients every time they come and see us, right? It's not about taking our patients through the motions that we think are going to be helpful to them. We have to speak to that patient in front of us and assess their current symptoms, their current presentation of severity and irritability related to these weather changes, and seek to find a deeper understanding to their pain behaviors and pain beliefs in that moment, and then address those specific findings as needed. But that assessment needs to happen when they come through your door each and every time.
And then also being aware, right? So the new PT might not be thinking of this. Anybody might not be thinking of this, but when some big weather event is about to occur and how stressful it can be, and we talked about this before as well, but how stressful this can be and how your patient can come in with maybe an increase in pain because they're tense, they're worried, they're concerned, they're in that kind of state of mind.
Yeah, you really have to be empathetic in that situation, listening to your patient, listening to their concerns, addressing their stress, anxiety, or other feelings associated with that storm, but then also taking that into empowering them through your session, whether that be through your specific interventions or patient education.
So are you kind of dialing it back if somebody does, if you're thinking, okay, this person's kind of like heightened right now, let's not go super hard mode today. Let's kind of go a little bit easy, a little bit more almost recovery, in a sense.
Yeah, absolutely. Yeah, we have to treat to how they're presenting that day. And whether that be a psychologically or emotionally impacted feeling, we have to address that, and not ignore it.
Yeah. It's a easy, cool opportunity to make that connection with someone, right? As long as you can empathize the situation and recognize that, and this is easy to do. It might sound like, well, duh, but you got to shift gears a little bit, and what's your norm and how you might communicate and kind of, I say, sell therapy, because you got to educate the person on what they can achieve, but you got to rethink that, like, with what's going on, how often can they get in, or what are their expectations? So
yeah, and I'm sure not so easy when it's double booked back to back, and now you have to empathize on the fly as well.
Yeah,
I imagine there's challenges there. Okay, then what about realizing, okay, storm coming. I'm sure people don't think of, all right, storm coming, how is this going to impact my patient in terms of the way they feel? But now you almost have to understand, these people are going to get out. If they're not active, they're going to get out and be active in storm prep. Or if they are active, now they're going to be additionally active because of storm prep. So you're running into those issues as well, as you're trying to kind of like establish an equilibrium. And now you got like these blips on the radar of activity, and not just any activity. It's like high strenuous, really strenuous activity, and activity that requires a lot of different types of movements and pulling and pushing and lifting.
Absolutely. Yeah, these patients are doing things outside of their daily activities. You know, they may have originally come in for physical therapy with difficulty, you know, turning over in bed, you know, and now they're cleaning up tree limbs after a hurricane. So how do I manage those symptoms, those complaints, and those functional impairments? Well, you know, hey, we'll talk through them, and maybe allow this as an opportunity to retrain that activity. If this happens again, now they know how to lift and bend appropriately, without fear of re-injury.
Okay, and then were you going to say something, Ashley? Because I have
Well,
another big question.
I mean, it's interesting, right? Because it almost, in my mind, it's almost like a version of PNE, right? Pain neuroscience education, but yet tailored to like this traumatic event. And so first and foremost, it really is. It's about respecting and appreciating like what trauma that person has gone through, maybe in the past prior to this event, and um, uh, you know, really connecting and listening to the person to mold what their needs, to meet their needs. So.
Well, so okay, then we have the topic of like accessibility to care, because if the storms, which they have been, are severe enough, you might not even be able to treat the patient. So now they're in like pain, but they can't get in, or maybe you can't get in. And so now we have this kind of like separation. Then what do you do?
Yeah, it was a challenge to try to get in touch with our patients if we couldn't see them physically here in the clinic, whether it be physical access, our roads were damaged and blocked or flooded. Transportation companies that these patients rely on to get to their physical therapy or other doctor's appointments were canceled. Significant costs were incurred by these patients. They already might have $90 copays I've seen, and now they've had to put some other finances into home repairs, or other financial implications that, you know, were a barrier to access in our clinic. So we had to get a little creative. So I feel a lot of value in telehealth medicine in these opportunities of storms, as well as remote therapeutic monitoring was a way for me to check in with our patients and their home exercise program compliance, or dealing with those new issues that came about while they weren't able to be seen in the clinic.
Yeah, yep, those are all good points to be made.
I
and
think
you were able to do that, Alyssa, as somebody that treats in the clinic. You were also then able to jump into like telehealth mode.
Well, thankfully we have therapists who do telehealth for our region that was available for our patients when they were able to. But remote therapeutic monitoring is something we do on a regular basis, where we can jump in and chat with our patients, update their exercises, or modify their home treatment plans.
That's awesome. Ashley, sorry I interrupted you.
No, you're good. You know, it's a unique situation, right? Because as a therapist, I mean, first and foremost, like, our profession is one of the most affordable ways to help improve people's function and hopefully get them out of pain or feel better. And we have to work really hard in general to encourage, to promote what needs to be done. I mean, there's just a tremendous amount that has to go into physical therapy, occupational therapy, like any of the rehab services in general, to get buy-in. I truly believe that, like, we don't go into this to be salespeople, but you've got to be able to sell it, to then allow the person to make their own decisions. Well, now all of a sudden you throw in, you know, components of weather-related events and stressful things going on in their life. Yet, as therapists, in the meantime, regardless of costs and what's going on, you still can't help but wonder and hope that it's like, I hope that they don't push this aside, because what happens 5 years down the road, right? So it's it really is, it's a challenge, and it's a unique situation to be in.
Alyssa, was there anything that you like learned? So we had storms. Is there anything you kind of didn't know that you can remember? Didn't know before, but know now, and that's prepared you for this in the future?
I think so even just managing patients' chronic health conditions or mental health status during this time was a great learning opportunity for me, to know and tell my patients, hey, you can go to the pharmacy and get your prescription medications in preparation for this hurricane. So that way you don't run out of your blood pressure medications while you are evacuated or unable to get to the pharmacy. What strategies do you have now to deal with your emotional well-being that you can tap into during these times of stress and anxiety? Those were things that I wasn't prepared to talk about, but were eye-opening and a learning experience for me.
Those are good points. Ashley, anything to add on there?
Well, I think kind of going off of that, just beyond your orthopedic back issues, shoulder issues, all that. I mean, there's plenty of people that, whether we're talking about balance and falls and, are they living on their own? Do they have support? There are a handful of people that kind of live on the edge, right? And it's an opportunity for us, even if it seems simple to us as clinicians, but addressing safety concerns, particularly before, but also after, to make sure that their risk of falls or whatever it might be with them is eliminated.
All right. I think if I was a clinician, I would have been informed by a lot of what you shared. Anything else you want to add to the topic?
We need to bring in a clinician from up near your neck of the woods so they can talk about snowstorms and everything that comes with that, right?
Shoveling. Well, remember we have colleagues in Wisconsin and Chicago.
Yes.
So
Mhm.
yeah, we got people shoveling around here. I do have a snowblower now, which makes life a little easier. But yeah,
for you.
again, goes back to encouraging patients get healthy, get fit, exercise, move around.
Mhm.
Okay, so physical therapist, meteorologist, psychotherapist. What
We wear many
else?
hats. Yes.
Yeah. All right. Cool. If there's nothing else, then we're going to wrap this one up. Thank you again, Alyssa. Thank you, Ashley, and we'll talk soon.